In this webinar, we shall learn about legal issues and follow up pertaining to retinopathy of prematurity. The objectives would be to know about the legal issues that can arise and also to know how to prevent these legal problems and also learn about importance of follow up. The legal issues that could arise could be due to poor communication with the parents, poor documentation of the screening and treatment, complications arising out of procedures and lack of follow up. Let us look at proper communication first. The need and timing of ROP screening must be communicated to the parents by the doctor, the pediatrician or the neonatologist, the nurse and the ophthalmologist. The timing should be explained in the parents' language in easy understandable terms, and their understanding should also be checked, because it is very important that the first screening should be done at the right time. At least it should be done within 28 days of life or 2 to 3 weeks in very small immature babies. They should be also provided with a parent information leaflet in the language known to them, and also phone call reminders and linking with a local doctor and health workers are also important steps to improve follow up rates. This important community linking will produce compliance of the parents, and also they will bring the babies for screening and follow up. The next we will talk about the consent form. A consent form before any procedure, especially laser or surgery, should include the details of the nature of the disease, the possible side effects of the procedure and complications of the treatment. Also, they should also talk about the outcome of either laser treatment or surgical management. It should be prepared in at least 2 languages, again simple and understandable terms. The same must be communicated verbally also to the parents. Parents who can read the consent form should read it and understand it, and they should sign in the witness with the health personnel around. And also we should check their understanding of not only the procedure, the disease nature and the possible complications thoroughly before we subject the babies for surgery, because the outcome of laser treatment and surgical management cannot be predicted. So, this possible outcome which cannot be predicted also should be told to the parents. Now, we will talk about proper documentation. So, the discharge summary usually is in English, but it should contain the findings of the first screening and the date and the place for follow up. If first screening has to be done after discharge, that date and the place for first screening also should be mentioned in the local language or in the language understood by the parents. Advice regarding retinopathy of prematurity screening preferably should be done in the local language. The case record, that is the case sheet of the baby, must also contain the details of the screening and the treatment given as shown in the figure. Then there should be multiple checklists. See, it is not only enough if you properly communicate and document, there should be checklists and systems which we should have, so that this is thoroughly checked by the health personnel of the SNCU or NICUs, so that each person is assigned their own role and responsibility. So, especially the roles and responsibility would include screening line list, that means the number of children who have to be screened and what is the time at which they have to be screened, and then when was the screening done and the treatment given, and when they should come for follow up. So, these are the important areas which should be given responsibility to all the health workers in the SNCU. Especially this responsibility lies with the doctor, the follow up nurse, and also the ophthalmologist, and also the optometrist in the RBSK scheme. Follow up examination should be individualized, because it depends on the nature of the disease, the severity of the disease for the particular child, the treatment the child has received, and also the follow up findings which may show regression or progression. So, it should be very individualized depending on all these above mentioned factors. And it is absolutely necessary that the neonate should undergo serial examinations till the retina is fully mature. It is not enough that the child undergoes only the first screening, and even if it is normal at that time, the child should undergo serial examinations till the retina is fully mature. These babies, even after complete vascularization of the retina, need continued follow up in childhood for assessment of vision, especially the visual acuity and for squint, because they may go for high refractory errors, especially myopia or astigmatism, and so they need follow up every 6 months in the first year, and from then onwards annually at least up to 5 years of age. For implementation of screening program and follow up program, we need a good support system in the SNCU and in the community. The support system should include the SNCU team and the RBSK team, the pediatrician, the follow up nurse, the ophthalmologist, and the optometrist, and the data entry operator, because each one have assigned roles. The pediatrician to make the baby undergo screening, the nurse to see that follow up is done, and the data entry operator to see that everything is documented properly along with the doctor and the nurse. And the trained ophthalmologist is very essential, because at all SNCUs we need screening facility. So, it is important that the ophthalmologist at the district level undergoes training to specially look at the ROP. And at the community level, if you look at the persons who would be part of the support system are ANMs, ASHAs, and Anganwadi workers. They will link the parents to the SNCUs by the follow up system of the SNCU, which will send SMS to the parents to come for follow up or treatment as the case may be. And also each SNCU should have screening facility where the ophthalmologist is trained, and also at least some of the SNCUs in the state should have treatment facility, that is laser therapy. And availability of early access to treatment is very important, because timely management is the one key factor which will prevent ongoing blindness. And it is not only enough to treat, and babies who have visual impairment have to be rehabilitated. For that we need social and educational support which will help these babies have quality life. So, the support system would include SNCU, RBSK team, ophthalmologist, community, and social and educational support. The key messages of this webinar would be: screening for ROP has to be done at the right time to prevent progression to severe forms. So, all the pediatricians should know the time at which screening has to be done, and multiple levels of checks and parent education will ensure follow up, thus avoiding complications and legal issues. It is very important that we educate the parents on the need for screening and also for follow up visits, very important. And then linking with various health functionaries is very crucial for the success of the ROP program, because linking and arranging transport and logistics is very important for follow up and success of this program. Thank you.